Good afternoon, everybody. Thank you for joining us on this lovely June 30th. Happy New Year's Eve for our fiscal year. Thank you again for making the time to be here with us. We do want to do a quick check. Can you hear us? If you'll type in the box.
And see our screen.
And see our screen.
Thank you very much.
Perfect. We are going to do a quick introduction to the team before we get started. I did just send an email out about 10 minutes ago with lots of handouts for today. You'll want to look at that so you can follow along. Our agenda did go out on Saturday and then again just about 10 minutes ago. I am Elizabeth Viola, Chief Program Officer here at the Coalition, and let's see who else is in the room with me.
This is Mercy Easter, Business Information Director.
Mary Brewster, Provider Relations.
This is Scott Stevenson, Quality Initiatives Director.
Liliana Howard, Professional Development.
And Roseanne Fricks. I have the pleasure of serving you as the CEO here at the Coalition, and I'm glad everybody's able to join us today. Thank you.
Thank you. We want to say thank you to our DCF counterparts that are on the line that have been with us for every call that we've done with you, so they're here to support us today. And we also want to say a special thank you to Representative Daniel Webster's Congressman Daniel Webster's representative, Cindy Brown, who also is well known in our community and makes great efforts to support us in what we do, and we appreciate you. Are you on the line, Cindy?
Give me just a second, I will unmute her. You are unmuted, Cindy.
Good afternoon. Can you hear me?
Yes, we can hear you. Hi, Cindy. How are you today?
Oh, I'm so well, and it's just wonderful to be part of this this webinar today. Thank you so much, Early Learning Coalition, and everyone involved with teaching and training and loving our young children, ELC. Anyway, thank you so much for all you do. Congressman Webster appreciates you more than words can say. He was so instrumental in starting this program years and years ago. So thank you for all you do, the wonderful programs that you've been doing, and the many lives and families that you have encouraged and touched during COVID-19 especially. So thank you so much, and thank you for letting me join you. I'm excited to learn.
We appreciate you being available today to join us. And again, thank you for all you and the congressmen do to support our community. We appreciate it so much. We are going to start our meeting off with a couple of things that actually are not on your agenda, but are pretty cool. So I'm going to turn it over to Roseanne to talk about something that's exciting that's happening today. Go ahead, Roseanne.
Yeah. Okay. As everybody knows, during fiscal year 18-19, we had some challenges with the Office of Early Learning's EFS mod system. And due to those challenges, you received payments, but we had some opportunities as far as ensuring that the payments that you were receiving were correct, and you remember all the stuff that we had to go through. So we finally came around and said we got to do all of this stuff manually. So we have been doing that here at the Coalition manually, and while we are still working on fiscal year 18-19, I am pleased to share with you the progress that we have made. So letters are going in the mail today, tomorrow at the latest, that will have a check for some of you who were underpaid according to what you received and then our manual calculation. So we are putting those in the mail to you. It is a live check. You will receive the envelope, obviously, from the Coalition. It will be certified mail return receipt requested so that we know that you got it, because as you know, we really don't deal with live checks. We felt this was important enough and wanted to ensure that you received it. And there is a letter in the envelope explaining everything. And then other letters that are in the process are for those providers that we paid you what you earned, and don't owe any money. So we are making progress, and what my decision has been made is that as we get a group of providers done, I'm handling it. I'm not waiting till everybody is through. So all of you will not, and let me repeat, all of you will not receive a letter from me next week because we are still going through the manual reconciliation. So this is just the first batch, and we wanted, like I said, to get those out to you as we are finalizing them. So we will continue working on this, and certainly every time that we're at the point of putting letters in the mail, whatever they're for, then you will be notified. And for some of you that may be in a situation that were overpaid, then you and I will be talking, I don't know, we'll see if you dare want to meet face to face or over the phone or whatever, and discussing the details of that. So I just want to update everybody on that, Elizabeth. And if they have any questions, let me know. Marcy and I have been working on this project.
Yeah.
Thank you, Elizabeth.
Thank you. So that is exciting news. It's a great way to start the meeting. We're going to stop and see if there's any questions real quick.
So the first question is, has anybody been overpaid?
Yes. Yes. If you are one of the providers that were overpaid, that's last on my list. I'm more concerned at this point with finalizing anyone that we owe money to. So anyone who has been overpaid, don't worry about it. We got plenty of time. We got, a new fiscal year, and we got other things to do first, and that certainly involves serving kids and stuff. So yes, and I hate to give you too much. I mean, if you called me, I'd be more than happy to talk to you specifically about it. I don't know who that was, Marcy. But even if I told you something that might be subject to change if the team hasn't finished that manual reconciliation process. But we do know that we overpaid some of our providers.
And just a comment, not a question. How do you eat an elephant? One bite at a time.
Oh, that's what we're doing. Thank you.
Thank you.
Yeah, we're working it.
So no other questions right now? All right, thank you. Yes, thank you, Roseanne. The next thing we want to talk about that's not on your agenda are the face masks that the coalition, I cannot say that word today, that the coalition has available for you. On Saturday and again today in the email, we did let providers know, and I appreciate how much response we got because it tells me you're reading our emails that we send out. That through partnership with our local homeless council, we were able to acquire a supply of cloth face masks that are reusable, they're rewashable, and we have received quite a few emails back from you all asking for a supply of those masks. So hang tight with us as we organize the way to distribute this, and we will get right back to you as we figure out the best way to get them out to you. It is probably going to look very similar to how we distributed the cleaning supplies, where you would just come by and get your set of masks, and that will make sure you're social distancing and we remain safe, because as you know, there is a huge influx of COVID positive cases in our community right now. So if you haven't requested face masks, feel free to send an email to quality@elc-marion.org, and we will get you on our list. Scott is tracking that with his team and quality so that we can get those organized and get out to you as soon as possible. So stay tuned for that. So you haven't probably, if you've requested a mask through email or masks, we haven't responded to those, but this is your response right now. Just hang tight and somebody will get back with you to let you know when to pick up those masks. That seems like a better way to reach out to all of you since we did get such a great response to that. Any questions? I'm going to pause in between each subject as we move along because there is a lot on our agenda today, and we have just a little bit of time to cover it all. So the next thing on your agenda is your school readiness and VPK attendance submission process. The due date is Monday, July 6th by midnight. I did go ahead and put the details. This is the same information that you've received previously from us with slight tweaking just for the current month for both school readiness and VPK. We had very minimal closures in June, thankfully. So we are looking into what to do with that. In the past, if you were closed, you were asked to submit your attendance anyhow. We're awaiting guidance, I would say, on whether or not we're able to pay those providers who remained closed in June, which was very, very minimal, like I said. So you have an attachment that has guidance for you on how to submit your attendance rosters. For the month of June, those providers that remained open are continuing to get reimbursed based on enrollment and not actual attendance. So you are still tracking those absences the same way you have been for the past few months. Hopefully that's a pretty clear process for you this time. Let me see if there's any questions. So again, your submission due date is July 6th. That's Monday, so you have the long weekend to get it into us. Remember, we need your sign-in and out sheets uploaded to BlueJean. If you did a summer VPK program or started your summer VPK program, you would need to upload your long or short form to BlueJean along with your sign-in and out sheet if that's applicable to you. If we had any fall programs that went into June, which I do not believe we did, then you would need to submit your attendance and upload appropriate backup documentation to BlueJean for that as well.
And one reminder on any new enrolled child into our program, you must have one attendance day before you can start marking A's or D's. Child has to physically attend, and that will be the first day of your attendance that you will be paid for.
Okay. I don't see any questions. So we're going to move on to parent fee waivers. Parent fees are also known as parent copays. The coalition will continue to pay those through July 31st, 2020. So this is your official announcement as of today. We are going to pay parent copays, continue to pay them. We've paid them since April 1st, and we will continue to pay them through July 31st. I want to share with you, we've had quite a few calls from parents telling us that they're still being charged their copay. So I want to encourage you to not do that, because they will turn you in and you will need to refund the parent copay. Now, you are allowed to charge your differential, which we have said from day one, and especially these are your BG1 ESF parents that are telling us this. So you want to make sure that you're not charging the copay, you're only charging the differential. You also can charge a registration fee if you have one. If you're charging one this year, you can charge that to the BG1 ESF parent. And that is told to them upon registering for this program with us. That initial contact, we let them know all about copays, and we let them know that effective August 1st, you will start collecting copays. As you can imagine, it's a somewhat difficult conversation to have with a parent who's never done this before. So we want you to be very diligent in the conversations that you have with your parents to really talk about the difference between a differential fee, which how I explain it to parents is the difference between what you charge to the public privately and what the coalition can pay you on behalf of their child. So there's a difference typically. I like to use simple examples. So I'll say if the provider charges $10 and the coalition is only paying $8, That $2 difference would be the responsibility of the parent typically. Now, we do have a handful of providers that do not charge a differential, and that is okay as well. So on your agenda, it just talks about the details as far as what the coalition pays you, how we pay you, that entire market rate right now through July 31st, what you can and cannot do in regard to parent copay at this time. And this is also to prepare you to have those conversations with your parents about parent copays. So starting August 1st, you will start to collect your parent copay again from your parents. So you can find that copay on your school readiness certificate. That's an EFS mod. And that's where you'll see how much the parent's assessed fee is. And that's including your BG1 ESS families, your first responder families. Let's pause for a second, see if there's any comments or questions.
So the first question is it too late to start summer VPK?
So summer VPK, the answer to that is no, if you can fit in 200 hours before the fall program starts. So summer VPK has been altered a bit from the requirement to offer 300 hours to now you are required to offer 200 hours. You also do not have to have 4 enrollments before you can start. You can start with just 1 enrollment. The rest of the requirements for the program are still intact. So they still must have that degreed teacher in the classroom. Your ratios stay 1 to 12. The rest of it remains the same. Your reimbursement would still be based off of the 300-hour reflection bill. So although you're only required to do 200 hours, you'll get paid as if you were offering the 300-hour program.
The next question is in regards to BG1 ESS children. We actually have a handout, and we will get to that a little bit further down in the agenda and be able to answer all those questions about those ESS kids in one shot.
Yes, and I did send, there's a couple of extra handouts that we sent today about quarter to 1 probably. So check if you're not seeing those extra pieces.
They're also attached.
They're attached here, thank you. I love technology most of the time. So thank you, Marcy, for doing that for us. So there's extra attachments that you'll want to look at there that will help us. If you recall at our meeting last Tuesday, we talked a little bit about the first responders, and I think even the previous meeting. And I told you we would put together something in writing to kind of clarify some of those things that were constant questions so that you could go back to it, because it is hard to talk about and keep everything clear. So we want to have something that can clarify it for us a little bit. Any other questions right now?
Another ESS, so I'll let you continue and
okay.
Also go ESS.
Okay. So we're going to move forward on our agenda, and Scott is going to talk to you about the school readiness contract extension.
Yes, good afternoon, everyone. Thanks, Elizabeth. I just wanted to give a quick update on the contract extensions. So last week we had asked everyone to, we had let you know we're emailing you a contract extension for your 1920 school readiness contract. We are in the process now of collecting all of them and finalizing them. So I want to say thank you. It was a very tight turnaround time. So thank you for making that a priority and getting those back into us as soon as you could. The priority really was to have them in office today, signed by all parties. And then soon, within the next couple weeks, you will see in the portal the uploaded extension under your contracts tab in the portal. So that'll be something that we do, but the signed contract extension will be in your portal in the contracts tab. A couple things we're doing as we've received these is we are double checking the first page where you put your name. And again, that was the legal name that you sign, that you file your taxes with. We're comparing that to your W-9 forms that you've uploaded in the portal. So as a part of that process, this may or may not have potentially kicked you into an incomplete status in your provider profile. So with attendance coming up, we encourage you to go in the portal to check and to see if you are in an incomplete status. I can say personally, as I was looking at some of the W-9s, as I went into your portal, some of them were already in an incomplete status. So we just encourage you to go in there to review your profile and submit it so we can get it out of that status. I think that's all I've got.
One other thing, there is about 20 or so that we have not received extensions back on. So you will be having another email come out. Go back, check your emails from last week, check to see if it's in the spam. If you have not signed, then please make sure you send an email to us in regards of what issues, or if you choose not to, extend your 1920 contract with us.
And please understand, this is Roseanne, please understand, without your contract, agreement, amendment, addendum, extension, whatever you want to call it, the coalition cannot pay you for any services as of tomorrow. Today will be the last day you receive funds for school readiness service provided by you. We must have that. I am not allowed. It is illegal. I cannot backdate. I will not backdate. So please, if you have no idea what we're talking about, you need to get on the phone and get through to somebody here at my office, because your paycheck today is the last day of your paycheck from the coalition without that contract extension.
And that includes everything from ESS bonuses to readiness enrollment to any other thing, and something else that we're going to talk about later on. So this is highly, highly important. If you are in touch with other providers in Marion County, ask them, did you submit it? Did you submit it? You know, let's support each other here, because we are doing the best that we can to make sure we get everybody taken care of so there is no lapse. And if a lapse occurs, then we have to start fresh the next day and you don't get paid. So that being said, let's check and see if there's any questions on that.
It asks, does this include VPK contract?
No, VPK we're going to talk about towards the end of the agenda there. But no, this is school readiness providers only. Now, if you're providing school readiness and VPK, you are in this group. So if you offer school readiness, that message is for you. All set? All right, Ms. Lilly is up next. She's going to talk to us about the quality performance system and class assessment.
Thank you, Elizabeth. Can you bring, yes, thank you. So on the handouts, you have a copy of an example of an email that you may receive from one of our team from the quality department, letting you know it's that time again to register in the quality performance system. One of the things I would like to do a little refresher with you guys is the process for the registration, which is also, and this is an example of the attachment that will also come with that email. Some of you have already gone through this process. This is for school readiness providers that will have class observations done. When you log in to the quality performance system at qps.floridaearlylearning.com, and you'll see a green box that says needs registration. You'll hit the go register button, and then it'll ask you for submitter details. If you are the person who is verifying the information on your account, you are the submitter. Congratulations. Please put your name and your job title, and doesn't have to be your personal phone number. It can be the phone number of the site. Can you scroll down just a little bit? And that will confirm yourself as a submitter. And then the next thing you'll do is you'll confirm your profile information. This is where you confirm your address. the site phone number, the site director, that type of information. The next thing you will be confirming is your teachers, their names, their hire dates, what classroom they're supposed to be in. And then the last thing you'll confirm is your classrooms, the age groups that are in each classroom. So that way it allows us to know what tool we're going to use when we go to do our observations. Let's go down a little bit. The last thing you should see, as long as everything is correct, is the acknowledgement. And this is where you hit the submit button. And once it goes into, is submitted, it'll be brought to our attention that you are pending review. And we will probably give you a call and go over the information and make sure that everything is correct with you. And then what we're also going to do is give you a 2-week window in which we're going to come and do your class observation. Now, you do have the right to give us 3 days that you would be unavailable, whether it be a crazy party or you're having a cleaning day because of COVID. You have 3 days that you can give us that are bad for us to come. So having said that, let me show you the login page. This is what the login page looks at. And again, that's qps.floridaearlylearning.com. Attached to the email that Elizabeth sent out was frequently asked questions. As you can see, the orange box is School Readiness Program Assessment Rules Frequently Asked Questions. Also available are the resources for the rules and about School Readiness Program Assessment itself. If you would like, if you have any questions about that, these are your resources that you can get to. There are 2 exceptions to a class observation. If you received a score of 5.00, which is a biannual score during your 2019-2020 contract, that makes you exempt from a class observation. If you have less than 20% school readiness enrollment in your site or your family home child care, that also makes you exempt from a class observation. The 20% is figured out when we take your number of enrollments and compare it to your capacity. There are a couple of situations that might postpone a class observation. If you are a new provider who is newly contracted with us, you have about a 30-day period to get adjusted before we register you and get you scheduled for a class observation. And if you have a new teacher that you've hired in the classroom, you have a 30-day period for that teacher to get acclimated to the students and the students to get acclimated to her, and then we put you in registration and get you ready for a class observation. And then the last thing that might postpone your class observation is if you open a brand new classroom altogether. We do ask, please, please, please. No, I'm going to emphasize, do not make changes without notifying us, and do not whatsoever make changes once you're in pending composite status. During this time, if you make any changes, that means we have to start all over again. Any questions?
I just want to reemphasize that. I'm glad she mentioned that because she's absolutely right. After you go through this registration process, what happens is the information goes over into Wells, which randomly selects the classrooms that are to be observed. So if you make any changes to the information in this QPS system, it's going to change those randomly selected classrooms. So in the past, it has caused us a couple issues where we've gone out to do observations, and then a change was made in the QPS, which changed the classrooms. So we may have already observed a classroom that now is showing in Wells is not required. So we're doing double the work. So as they go through and help you register, as part of the process, they will definitely remind you to please, please, please don't make any changes once you've hit that register button. When we call you back to go through it, if there are any, we can do that before we approve it.
Check and see if they have any questions.
What happens if the teacher changes or leaves?
What was the question?
What happens if the teacher changes or leaves?
If the teacher who changes or leaves, then you need to notify us and we can handle that case by case as necessary. But you need to notify us as quickly as possible.
Generally, the teacher who would replace that teacher needs to be in place for at least 30 days. So we would handle those on a case-by-case basis, but we really can't go in to observe a classroom unless the teacher in there has been there for at least 30 days.
If you are exempt, do you have to update anyway, or you do not have to update?
So as of tomorrow, with the new contract here, you will have to update on a monthly basis your staff roster and your classrooms if necessary. If you are in a family home child care setting, I recommend that you especially take close attention to the age group that you have, because of the way you can have a blended age group. You want to know what the majority age group you have and put that in your classroom as your tool.
How do I get my score from my last class observation?
When you go to the quality performance system, it's about the third option over to the right. It says composite score. That'll show you your composite score.
How do I know if I'm exempt from class observation?
When you go into your quality performance system account, it will tell you whether or not you are exempt. It'll be on the right-hand side under comments and notifications.
Awesome. Thank you, Lily. That was a quick update because we are going to begin doing our class observations pretty soon here. That being said, we want you to know that we are monitoring the COVID-19 situation very closely. We've had a lot of questions about how do I know if I should close my site, a lot of questions about guidelines as far as CDC guidelines go, and what happens if we are made aware that somebody came back positive for COVID, as well as how do I get my staff tested. So the coalition, we did have the staff that were interested in tested. We were able to get our team tested. So it was, it's not as bad as everybody says, just so you know. But you can contact the health department. I put a link in the email that was sent out today as well as Saturday, where you can go on to the health department website and get information about how to get your team tested if you're interested. Other pieces and other links that were included in the email also talk about, from Child Care Aware, they came out with a really interesting tool that helps you decide whether you should close your site or not. It asks some of those questions that you should keep in mind. And in the email from Saturday and today, again, there are some tips and pointers of how to communicate with your families if you find yourself in a situation. And also remember, this is fast moving and it's impacting everybody everywhere. So continue to clean, continue to practice safe social distancing measures, wear your masks, pay attention to what's going on because it is a dangerous world out there. And yesterday, somebody said something to me over the phone that I thought was interesting. One of our providers said, we don't know where these kids are going on the weekend. And it's a holiday weekend coming up. And I'll tell you, we are petrified over here about what's going to happen after a month from this weekend. So we're seeing all this spike right now, and it's a month out from Memorial Day weekend. So just keep that in mind, pay attention, continue to do your checks at the door before staff walk into this building or any guests walk into the coalition building. They're checked for a temperature, and we have to report every single day that we report to the office whether or not we are feeling well, if we've been exposed, and all of those different things. So we are taking great measures to keep you safe, to keep our staff safe so that we can continue to be here to support each other. We want to encourage the same thing for you. And so talking about measures that we're taking to support each other. The first responder essential medical personnel program has been a hit, I guess you could say. Last time we talked, we did promise you a sheet to help you kind of decipher what is going on with that. It's up on your screen. It was attached to the email today. It is current as of today. So right now, as we speak, there are 589 first responders or essential medical personnel in Marion County who are taking advantage of this opportunity or in the process. So let me tell you about in the process. We are, as you know, this started out with myself and Latricia Sims working on the initial contact and sending the referrals over to the employers. And then Liz Cowan in our Family Services Department is enrolling these families into your site. You also provided us with help in the very start of this back in April. I can't believe it's been that long already, by letting us know who was already enrolled at your site that you knew of who were first responders. We also, that process is not any different than for a new parent coming on. We still have to send the referral over to the employer and get them to verify their employment and send it back to us in order to move them over to the first responder, to the BG1 ESS category billing group. So we are still enrolling. We are asking, of course, for continued patience as we move forward with enrolling on this program because we're pulling more staff in to help us. As you can see, this is overwhelming. It's overwhelming for you and it's overwhelming for us. It's also overwhelming for our parents who are going from being a private pay family to now receiving subsidized care and all the things that go with that. So the only real true thing that was waived here was the income requirement. The parents still have to meet all the other pieces as far as providing us with the information that we need and allowing us the opportunity to contact their employer and get that referral back. So on the screen, you have a one-pager that kind of breaks down some of the components. We tried to do the best we could to include everything in this document that you have faced, the questions that we've answered. So the first top part is what happens with referrals and new enrollments in the program. It just gives you a little data about what's going on. We are going to continue to enroll parents in this program until July 31st, 2020. So July 31st will be the last day any new enrollments will be placed under the BG1 ESS category. Of course, the blanket statement is at this time. If anything changes, they couldn't even, okay, our team couldn't even stifle that giggle because this is something that we struggle with all the time, and you struggle with it too, is we try our best, and at Office of Early Learning, DCF, all of our partners in the community do the best that we can to make plans and keep everything as consistent as possible, and it just never fails that we have to change it and say, I'm sorry, here's an update. So as of today, this is what we know. We can continue to enroll in this program until July 31st. All referrals are for 90 days, okay? Some of them are retroactive, some of them are not. Some of them are based on the first day that they start at your program. We continue to receive numerous calls daily from brand new families that are just now finding out about the program that want to get enrolled. So that is a positive thing, and it's also overwhelming again, and so this is a good thing though. The next category is renewals of referrals. So we enrolled more than 400 families from April 1st, and that first round of referrals is expiring today. So we have a team here that is working, that has been working to renew those referrals. Initially, we told you, I believe last week or the week before, if the parent had not uploaded their documents, that we were going to have to terminate their enrollment. We reached out to the Office of Early Learning. We did not want to do that. So we reached out to the Office of Early Learning and said, we want to give these parents one more shot because we don't want to terminate their care right away. We're going to continue to support them as much as we can. to these parents that are still missing documentation. And these are the typical school readiness documents that need to be uploaded in CFS Mod. So there are things such as birth certificates, proof of residency, identification of parents or caregivers, as well as what am I else? I'm thinking of something else that I can't think of. Okay, the word is escaping me right now. If you are a resident of the United States, what is that?
Citizenship.
Thank you. Thank you. We could not say categories today. Proof of citizenship. So those are examples of the things that are missing. We will be sending out an automated call to the phone numbers on file for the parents that we still are missing something for. And it's going to be a blanket phone call so that we don't miss anybody. So you may have parents that have already submitted everything that may receive this call from us that says, please log on to your parent portal through EFS Mod and ensure that all of your documentation that's needed is uploaded. That will go out tomorrow. Parents will have until July 17th so we're actually being a little more generous than 2 weeks at this point. We're giving them a little more time because 17th falls on a Friday. So we wanted to be, have a clean cutoff date. Now, what I can tell you, and this is set right now, if the parent does not upload that stuff after we contact them and after your efforts, because I know you all have also been making efforts to get this information uploaded, we will have to terminate their care effective July 17th. Okay. Did I pause?
Yeah.
Okay, let's pause because that was a lot of information.
So I'm just going to go back one because one of the providers did make a comment on the subject beforehand that they had found good information on the local health department site, quite helpful when I had exposure questions.
That's good. Thank you for that. The health department, Department of Health here is trying along with all of our other community agencies to really get to be supportive and get the word out of what you can do.
So there's a question of try and rephrase it a little bit. Do we not need to ask for school excuse notes for this June and July?
Correct. No doctor's notes are needed for absences for June and July.
Will child care staff members be allowed to sign up as BG1 ESS families?
Unfortunately, unless they have a spouse that is working as a first responder or in the medical field. And remember, first responder encompasses a wide variety of things. So people working in corrections would also count in that. Support services for corrections, such as like food service, if they're working in Lowell or one of the prisons or juvenile detention, that would count. Unfortunately, at this time, our teachers do not fall under that category.
I think this goes back to the beginning area of what Elizabeth was stating. You may find that you do have parents that are ESS and that have not been processed in the system yet.
So let me talk a little bit about that. So we are trying our hardest to get those that are already enrolled in school readiness services that qualify for this program. We're trying to get them flipped over. There's two pieces to that. One, the parent has to be okay with it, because what it means is that we are reaching out to their employer, which previously we did not do that. If they qualified for school readiness services, we verified their employment based on their check stub, which means that their employer doesn't need to know necessarily or know at all that they're participating in the school readiness program. And some parents do want to keep that information to themselves, and that's okay. That's their right. So it's parental choice whether they want to participate in this program or not, for one, if they're already in school readiness. And for two, it is a process. We still have to complete the referral and send it over to the parent's employer and get that referral back. So we are trying to do that for the parents that are already enrolled. We have numerous parents that are asking to go that direction. For them, it doesn't change a whole lot at all. It actually doesn't change at all until August 1st when they have to go back to paying their copay. What it does for you as a provider is it allows you access to that BG1 ESS bonus payment. So we are still working towards that, and we will continue to look at those families.
So they're confirming, so all, I think they meant ESS, not EFS, enrollments are extended to 7/17 even if they started on 4/1.
So with that, if their referral was 4/1, their referral is going to expire in 6/30. We are reaching out to the employers to get a renewed referral, even if they, so essentially the answer is yes. We are having to still go through the process, though, to get the new referral. So then if they don't update their stuff, though, we will have to terminate their care by the 17th if they don't update their paperwork in EFS mod.
And that message will be going out through email and phone calls to them. And I believe we're going to put it out to the providers as well, so the providers know what the parents are being told.
Yeah, you will. So we'll include you on that automated. Do we want to include it on the phone bite?
Yes.
So you will get, those of you that haven't opted out, some of you have opted out from our phone bite automated messages, which I highly encourage you not to do so, because that's how you get our emergency calls through the Pearl system. But if you haven't, you will get that call so that you know when you hear it. It's very similar to, if you haven't heard one yet, it's very similar to that call that you get as a parent from Marion County Public School System, where it's, you know, or any automated call that you get that's giving you an announcement. So that way you can hear what we're saying. And we'll also send you a copy of the email that goes out to parents so that you can see what we're telling them. And we can use the same language. Most of you have already been on your parents, and we appreciate that, because we don't want them to lose this service if it's benefiting them, which it most likely is. We don't want them to get terminated early. Just checking to see if we have any more questions before we go down to parent copays.
Sorry, I am answering some of your questions privately here. Okay, so that takes care of that one. No additional questions at this moment.
Okay, so on the document that we created for you, down the third section is parent copays. The parent copay, again, to talk about what we talked about earlier in our meeting, is we will cover the parent copay for all enrollments for the school readiness program through July 31st, 2020. So as we're talking to parents, we're trying to give them all the information regarding what will happen come August 1st, that they will be responsible for the assessed parent copay based on their family size and income. So even if their income was over what our school readiness program typically would allow, they would be assessed at probably the highest rate on our sliding fee scale. And remember, effective July 1st, our sliding fee scale is updated just like it is every year. So your new families being enrolled will have a different copay potentially. Anybody that's enrolled after July 1st versus those that were enrolled prior to June 30th, prior to June 30th. So effective August 1st, they'll be responsible for the differential if you charge one and the assessed parent copay. You can find the copay on your certificate for school readiness. I believe it's in multiple places throughout MOD, but the certificate is a reliable resource for you. If you can't see the certificate, that's another great opportunity for you to talk with your parents about logging on to their parent portal and accepting the terms and conditions so that you can see that certificate. I think that's it for that particular section. So let's move down and talk about bonuses for providers. There's been a lot of questions on bonuses. So Marcy's telling me, hold on one second. So let's check and see if somebody popped in to the questions box.
Clarification on the start of the parent copay was April 1st, not March 1st.
April 1st, correct. Yeah, the coalition started paying you the entire market rate, and therefore covering all parent copays starting April 1st, and we will continue to do so through July 31st. All right, so let's talk about bonuses for providers. So the bonuses are being paid out each month to you. We started that back in May once we found out about the bonuses for you. In here, there are four bullet points underneath this section. I encourage you to read them because I can tell you, and I'm going to try to do my best to tell you again how this works, but it can get very complicated. So the bonus is being paid out each month. So the second bullet kind of does talk about and addresses the question that we get all the time, which is, I didn't get paid for 2 of my kids. So the short answer to that is, if the parent applied, so I'm just going to go with the example that's in here. So the parent applied mid-June. We were able to enroll them in the BG1 ESS program on June 15th, but the referral was retroactive back to May 1st. So the provider would then receive the BG1 ESS bonus payment for that child for May and June with the July payment. Because remember, we're behind 1 month. So they are enrolled. If the enrollment is not completed for the BG1 ESS program prior to the close of attendance for that month, you're going to see your bonus come for that children in the following month. So you'll be behind. Okay, so again, I'm just going to encourage you, I'm going to leave it at that. I'm not going to add too many words to that at all. I'm going to encourage you to read that second bullet so that you can kind of digest it and understand why you're not seeing those payments just yet. But we are catching up every month with them. Bonus payments continue to be $500 for eligible BG1 ESS enrollment with a maximum of 8 enrollments per month, totaling $4,000 bonus per month max. And your total overall bonus for this program is $12,000 per provider. And then the last bullet in that section says, once enrolled, the child has to attend at least 1 day in the month in order for you to be eligible for that bonus. Okay, so let me pause there because this is a hot topic. We can continue to get questions about this one. I want to see if there's any questions that we can answer.
So far, none about the bonus. So I have one question. If the parent does not send in needed information, will ELC still pay for that parent through July 31st?
No, we can't. Their services will be terminated as of the 17th. These parents, please know that these are the parents that their referral started April 1st and went through June 30th. These parents have been already contacted by our staff. They've been told what needed to be updated, and it's also in their portal what needs to be uploaded. They may need help uploading. So I encourage you, be open to allowing them to sit at your computer if you're able to help them upload any of those documents so that their services are not terminated. So with that, you will not get paid past the 17th if we have to terminate those services, because they would no longer be enrolled at your site for school readiness.
Can you remind me the market rate for an infant, please?
Say it out loud, Mary. Go for it. Mary knows this off the top of her head.
$24.15 a day for infants, if that's full-time.
Full-time for a center. Now, if you need your market rates, I have sent them out a couple times through our COVID updates or provider meeting updates so that you can have them. It's also found in your contract. So feel free to log into your contract so you can see what that is, because remember, page 12, Mary knows this. I love it. Thank you, Mary. Mary's telling at the bottom, she said. So Mary doesn't have to whisper. We'll let her talk sometimes. But no, thank you, Mary. I appreciate that. You know that right off the top of your head. But remember, your market rate's going to differ depending on the age of the child, the type of center or childcare facility you are, as well as whether the child is full-time or part-time. So those are all things you want to keep in mind. And full-time and part-time is determined by the parent's eligibility for the program. So you do want to pay attention to that on your certificate. Do we have more?
Yep, we do have more, but we are going to pause for an announcement. Richard with DCF needed to jump off, but he wanted us to announce that DCF will be having a Child Care Regulations COVID-19 guidance webinar for Circuit 5 on July 10th from 10 a.m. to 11 a.m. All providers should receive an email notification. For any questions, have them contact Avita Rosa.
Awesome. Thank you. We'll look forward to that. We appreciate it.
Okay, and continuing from there, when Marion County pays out bonuses, is it included with monthly reimbursement or is it a separate payment?
It is a separate payment.
Separate payment. That's strange. Okay.
Looks like it's divisible by 500. Yes.
Okay. So I don't think we have any more questions on bonuses right now. So that bonus comes out in a separate payment around the time probably that you get your school readiness payment, right?
It will generally be 2 to 3 days later, but it will not be the same day as your school readiness payment. We did that to avoid confusion. We tried.
So your bonuses come in a separate payment, typically 2 to 3 days after your school readiness payment is deposited. Those are our direct deposit.
Okay, so we did have one more I did miss.
Okay.
There is a request, can we get a list of the families that are missing the documents to help them and for them to not lose care?
Unfortunately, we cannot tell you that. We're going to do a blanket statement to all enrolled families to say if you, to double check your account to make sure nothing is needed. That is it's an individual family piece, if you will. So we encourage just hit everybody. You know, if they log in and everything's great, that's awesome. Give them a star sticker on the sign-in sheet. You know, thank you for doing your part. We appreciate it. But this is, when you have 589 plus more coming every day, it's a hard piece to individually see who's missing that. So we want to cover everybody. With that, I'm looking at Marcy, but I think we're okay.
Maybe the payments. They will be, we have to wait for the BBK validations to be completed, and we are waiting for OEL to correct the reports. So once those reports are corrected by OEL, then we can get the reports out to you to verify your attendance for the entire year. And once that is done, then we can release the final payments for the school year. So we are waiting to hear from OEL so then they get those reports corrected.
And another question was, are the certificates going to be updated in the portal for the kids that got extensions for regular children and the ESS?
Okay, hold on. We need to take a breath before we answer that.
OEL mod team is working on that. I don't have a better answer than that. It has been requested, but unfortunately there are other pieces to make sure you guys are getting the payments that you need that have to be updated, and the contracts that have kind of taken priority over that. When you look at your enrollment screen, it should show some updated information right there for the children that have been extended. But I do know they are working on getting those certificates updated.
Okay. So the rest on that form for first responders, going back to that, it just talks about how we're still enrolling families that have been attending your site, what I started this conversation with, and then talking about just giving you a reminder. Remember to go back. If you have kids that were retroactive actively enrolled, through their referral. So they might just we might get their referral back today, June 30th, but they're retroactively enrolled back to May 1st. You'll want to go back and claim those kids on your May attendance so that we can pay you for that. The other thing is to remind you that we do need sign-in and out sheets for these kids, even if they're retroactively enrolled. So when they're private pay, you would still have a sign-in and out sheet for them to track their attendance there privately through DCF regulation. And those sign-in sheets, the private pay ones for BG1 ESS, need to be uploaded to BlueJean. So just a reminder about that. Now we are at our 2 o'clock mark. So in order to be respectful of your time, I want to go through these really quick updates because they are important for you to know. So I'm going to skate through this. Originally, Scott and I were going to tag team the VPK orientation one, but right now I'm really going to fly through it. EFS mod updates. Well, I'm sorry, I skipped. Emergency Funding Assistance Grant Opportunity. Okay, there is a new grant coming out. You will receive more information from it as we are able to finalize the details with OEL. And the grant is going to be to assist you in continuing on with the services that you offered. The grant is available to all of our providers that are open. There's a lot of details. I'm going to be vague on this because we need to solidify some of the details before we throw it out there. Just know it's coming. Watch your email. It is a grant opportunity for providers both contracted with us and not contracted with us, which is an interesting spin. The next thing on your agenda is EFS mod update. Effective today. Today is going to be the last day that the coalition enrolls children on your behalf. So what that means is in EFS mod, and some of you are already doing it, we will enroll a school readiness child and you have to go into EFS mod and accept the enrollment. This helps to keep your data clean and our data clean for enrollments and what happens. It also encourages parents to reach out to you ahead of time to go through that orientation process, to get a tour, to understand your policies and procedures, and to make sure that they understand all of your expectations for enrollment as well as your understanding of their needs as a family. So effective tomorrow, you will start to see where you need to go into EFS mod to accept any enrollment. So if you're wondering why this child showed up at your door or anything like that, or didn't show up at your door, go log into EFS mod to accept the enrollment. Marcy wants to add to that. Go ahead.
Okay, so one of the things this is going to save you on is when those parents don't show up. So right now we're getting emails from providers showing this child never showed up. I don't know why they're on our attendance for the last 2-3 months. So with that being said, you are going to have control of that. Our family service will still be making the one phone call to you to let you know that someone has requested, but we will not, even if you ask us to, we will not enroll on your behalf. You will have to go into your portal to enroll that child. You should have once you log in, it should be on your dashboard to let you know that there is children there waiting for your approval on the enrollment. So that's definitely one of the things that is going to save you having to go back and forth on why children are still there, though they've never been to your site.
And this is us moving into providing you with more control over what happens at your site. The other thing that we want to talk about is please make sure you're terminating children. If you need help with the termination process, our quality team can help you. It is also outlined in the EFS mod user guide that is available. If you don't have that or you like it, let us know. It's on BlueJean. So there's a link on BlueJean that can take you right to that EFS mod user guide. If you hit Control F while you're in that user guide, you can search it for different things because the guide is extensive. So you can search it for keywords that you're just looking for. So if you need help terminating a child, but again, this goes back to clean data. That's like my new term right now is we want clean data. We want to make sure that the kids that are in there in the system and are enrolled are actually there and they're attending, and we're providing services to families that need it. Anything else you want to add?
Actually, I just want to roll from there to the next piece, and that is termination of a child.
That's what I said.
Oh, that we'll need you guys to go in and complete that. If you remember, when you're in the enrollment screen for the child, right there next to their certificate, it says terminate child.
Yep.
That is something that will definitely need you to start handling, because that puts it back into your hand that once you do that, you know that child is terminated and you should never see that child there again.
Yeah. And if you're terminating a child, also remember you may need to complete a zero balance form still. We're still collecting the zero balance forms uploaded to Blue Jean. A parent cannot transfer their services, even if it's been 5 years since they attended your site. If we have that enrollment, they need that zero balance form to transfer. I'm going to stop really quickly. I know we're over our time, but I think we've had some really great discussion today and great questions. I want to see if there are any more questions right now for that.
No, but just a little bit of clarification, and we'll let you handle this one. On the ESS, if they went through July 5th, how are you handling those? Are those going to terminate on July 5th, or are they going to get extended?
So right now we've been given the okay to extend the families that had their referrals through today, through June 30th. This program is scheduled to end by September 30th. So we are looking at those families that are enrolled to see if we can roll them over to a BG8. However, we are not trying to get new referrals for anybody past today. So you're, if you do have people that are ending July 5th or anytime in July, then that is their end date at this time, unless they're eligible to be rolled over, which we are looking at that. If we can avoid terminating a family, we will. So I think we are just got a new question. We're good? Okay, so the last thing on our agenda today before we say thank you for giving us extra time, we appreciate it, is your fiscal year 2021 VPK orientation. Save the date for those, which is going to be Tuesday, July 21st at 1 p.m. or Thursday, July 23rd. And Scott and I had originally talked about doing an evening for that. So we're going to look at 6 p.m. for that. So we're going to do 1 p.m. on July 21st or 6 p.m. on July 23rd. This is a save the date announcement because this is going to be virtual. Again, it'll be the same way that we're doing this year. So if you're interested in offering VPK in the fall, starting right now, slated to start August 10th, unless you decided on your profile to start at a different time. We will be doing the VPK orientation. This is where we will go over your contract for the next year. This is where we will talk about certificates of eligibility. This is where we will talk about other things that the coalition has in place to support you with your VPK program. We have made numerous pleas with you. If you are a provider on probation this year, and you are choosing to offer VPK, you do need an improvement plan in place, and it has to be approved. And Scott, can you remind me what the due date was that we set for that?
So the due date was actually July 10th, and that's the very latest that it could be approved. So it needs to be submitted as soon as possible. We still have 17 of these right now outstanding. All 17 of those have been assigned to my quality team. So if you've received an email or a voicemail from someone in our quality staff please reach back out to them, especially if you're still a little lost on the process. But we can't emphasize enough that please go in the system and put your improvement plan in. It really doesn't take long. It takes 15 to 20 minutes, maybe 30 if you're not technically savvy. So again, there's 17 of you. If your projected start date of school is going to be August 10th, that's where we got the July 10th date from. Anytime after submitting, July 10th, that's going to push your start date that much further forward.
All right. VPK contract sent.
VP, what do you mean?
Have the VPK contracts been sent?
They have not been sent out yet. If you want to look at the contract, that one hasn't changed this year, so it's available. You can look at your same contract from this year. That is going to be the same contract that we enter into for next year. It's already on the OEL website as well, so we will get that initiated and out to you probably in a very similar fashion that we did for the school readiness contract extension. That did work. You all have been very receptive to technology, and we appreciate that more than we can say, especially in this time of the year with COVID and everything, and us being socially distanced and missing you. We do miss your beautiful faces. But we appreciate you doing all that you're doing to continue to work with us. The next thing on the agenda and underneath the VPK orientation piece is the VPK assessments. We've gotten 4 requests for new kits. I went ahead and approved the ones that were submitted, but please remember, if you request a kit 7 days ahead, more than 7 days before we execute your contract, we're not supposed to approve it. So I did go ahead and approve those of you that submitted. That's something big to keep in mind. This year, so many changes happened with the fiscal year 1920 when it comes to things being put off or not having to do anything. That resets now. With this new fiscal year, we are going back to doing our VPK assessments. So you'll have your AP1. Those of you that are on an improvement plan will also have to participate in the mid-year AP2, as well as AP3 that happens at the end of your VPK program. If you need a new kit, there is information on ordering kits on OEL's website. The Bright Beginnings website is where you would go through to add to make that request. I'm trying to think off the top of my head. I don't know if that one's on Blue Jean. I can't remember if the link to that is on Blue Jean. But if you need help figuring that out, just let us know and we can include that. Let's see.
Do we need a kit is the question. Do we need a new kit?
If you have sufficient materials, the assessment has not been changed this year. Whether that delights you or you hate that, I don't know, but it has not changed this year. So if you still have materials, you can use the same materials. If you need more, you can request a replacement kit.
What is the best contact info for improvement plan questions and verifications on our submitted plan?
Can you?
Is that you, Scott?
Yeah.
You're the best contact?
What is the best contact information for improvement plan questions and verification on our submitted plan?
Yes, you can contact me, and that's you can reach me by my email. That's sstevenson@elc-marion.org, or you can call the coalition, and my extension is 238. And again, I encourage you, we have had quality staff reaching out to those providers who have not yet submitted their improvement plan. So if you've received a message, it would be from either Sienna, Lily, Tiffany, or Vidmary. Any of those, feel free to reach out to them and they can assist you as well.
I want to say either I dreamt this or maybe I did include it in our last email blast, or I can include it in another one. But I want to say that I included the link for Bright Beginnings or the ordering information for the kids. If I dreamt that, I'm sorry, we can get that back out to you, but I really, if I did dream it, I was thinking of you. Let's see if we have any more questions before we wrap up for the day. That is it. Okay. Well, once again, thank you for your time. You gave us an extra 16 minutes, and we appreciate that truly. Our team is still giving training time for the certificates for your time here. We'll make sure we extend it to 1.25 hours, and be on the lookout for information on how you will get your face masks. And we appreciate you. Thank you. Have a great day, everybody. Bye-bye.